Aecysmux detailed information. Aecysmux. Drug name Aecysmux. Active ingredient acetylcysteine. Dosage form film-coated tablets. Uses support treatment of respiratory diseases. Thinning mucus, helping to dissolve phlegm and make it easier to cough up in patients with acute and chronic bronchitis, pneumonia, sinusitis, otitis media, asthma. Support the treatment of paracetamol poisoning. Uses thinning mucus, helping to dissolve phlegm and make it easier to cough up in patients with acute and chronic bronchitis, pneumonia, sinusitis, otitis media, asthma. Support the treatment of paracetamol poisoning. Uses thinning mucus, helping to dissolve phlegm and make it easier to cough up in patients with acute and chronic bronchitis, pneumonia, sinusitis, otitis media, asthma. Support the treatment of paracetamol poisoning. Dosage and administration. Dosage as directed by a physician or as instructed on the drug label. Administration. Take the medicine with water, it can be taken after a meal or before a meal. Duration of use. Adhere to the doctor's instructions. Side effects. Common: diarrhea, nausea, vomiting, abdominal pain, rash, itching, hives. Diarrhea, nausea, vomiting, abdominal pain, rash, itching, hives. Uncommon side effects: bronchospasm, shortness of breath, drowsiness, dizziness. Bronchospasm, shortness of breath, drowsiness, dizziness. Rare. Anaphylactic shock. Side effects: respiratory failure, anaphylactic shock, respiratory failure, diarrhea, nausea, vomiting, abdominal pain, rash, itching, hives. Bronchospasm, shortness of breath. Side effects: drowsiness, dizziness, anaphylactic shock, respiratory failure. Drug interactions: increased vasodilating effect and platelet aggregation inhibition when used concurrently with nitroglycerin. Should not be combined with substances with oxidizing properties because acetylcysteine is a reducing agent. Drug interactions. Note: inform your doctor about all medications you are taking, including prescription, over-the-counter, herbal, and dietary supplements. Precautions: patients at risk of developing asthma. Closely monitor patients when using Aecysmux. Patients with a history of allergy. If bronchospasm occurs, use a bronchodilator spray such as salbutamol or ipratropium and stop using Aecysmux immediately. Precautions: increased mucus secretion. More thinned mucus in the bronchi may occur during treatment with Aecysmux. It is necessary to aspirate to remove it if you have reduced coughing ability. Precautions: sodium restricted diet. Aecysmux 200 mg contains 17.5 mol 401.9 mg sodium per tablet, which should be considered in patients on a sodium restricted diet. Drowsiness: in a small number of cases, Aecysmux may cause drowsiness. Drivers and machine operators should be careful when taking the medicine. Precautions: pregnancy and breastfeeding. Do not use Aecysmux for pregnant women and breastfeeding women. Children should use the drug as directed by a doctor. Elderly: exercise caution when using the drug in the elderly. Storage: store at room temperature, in a dry place, away from direct sunlight. Keep out of reach of children. Note: information about Aecysmux provided here is for reference only and is not a substitute for medical advice. Before using the drug, you should consult a doctor or pharmacist for advice and appropriate prescription. Always follow the instructions of your doctor or pharmacist when using the drug. Note: do not change the dosage or duration of use of the drug without consulting your doctor. If you experience any side effects while using the drug, inform your doctor or pharmacist immediately.